let's chat about this video from Sovereign Parenting. So I've been tagging this video because it talks about refusing an IV in the hospital when giving birth. Because even if it's hospital policy, you can still refuse. And the answer is you can refuse anything in the hospital. We cannot make you do anything, hospital policy or no hospital policy. All we have to document is that you refused what we recommended, period. Then that obviously lends itself to the next question. Why are you going into the hospital then? There's no question that hospital births are associated with more interventions. They are, when compared to a home birth or a birth center birth. Those interventions can include placing an IV, fetal monitoring, starting Pitocin, having an induction of labor, all of those things associated with delivery. But it also includes interventions such as getting a blood transfusion if you hemorrhage, getting antibiotics if you develop chorioamnionitis, getting neonatal resuscitation if your neonate needs it, having access to the NICU, having access to a higher level of care should you need it. And regardless whether or not people want to acknowledge this, including Sovereign Parenting, low risk births can turn high risk in a matter of seconds. I've been doing this for 22 years and I've seen it happen a lot. So first, if you are someone who already knows you don't want interventions and you know what interventions you don't want and you know what it means to decline interventions, start having those conversations with your obstetrical care provider or midwife or whoever it may be sooner than later so they know what you're expecting and what you do and do not want during your birthing process. Having realistic expectations of what a hospital birth is going to be like or might be like is the key. But I also want to make this very clear. There are a lot of people, low risk pregnancies even, who want a hospital birth because of the interventions that we offer and because of the interventions we can provide if things go wrong, whether it be with the neonate or the person delivering the neonate. And there is absolutely nothing wrong with that. There are so many accounts telling you what you shouldn't do, or that you can refuse this, you can refuse that, your autonomy is being taken away, and this and that. And I get that because a lot of people's autonomy has been taken away. But that doesn't mean that's what you need. You have to decide for yourself. So if you want a hospital birth because you want to have access to those interventions should you need them, that is perfectly fine too. To my knowledge, and I've looked, Sovereign Parenting has no medical credentials whatsoever. So what they should be doing is talking about what they did for themselves and not making any medical recommendations for anyone else. So remember, all these things that accounts like this are telling you not to do or refuse, they're also putting in their bio or somewhere that they're not giving you medical advice. If any account is telling you something to do that is different than what is indicated or recommended or standard of care, that is still medical advice, in my opinion. A few days ago, I put out a video about hospital interventions and whether or not people can or should refuse them. So when I said, why come to the hospital at all then if you don't want interventions? I said that because there were many comments on Sovereign Parenting's video from healthcare providers specifically, but also from those who are not in healthcare about, well, if you don't want this, you don't want that, why are you going to the hospital? You're just taking up space from somebody who does want interventions. In my video, I felt it was pretty clear that I don't subscribe to that line of thinking because I went on to talk about having discussions with your provider about the interventions, what you do and do not want, and having an understanding of interventions, as well as what to expect with a hospital birth. But there were a lot of people, well, not a lot of people, but some, who felt that I was saying, why even come to the hospital? And I want to make it clear, that is not what I'm saying. People can come to the hospital and have the right to refuse interventions. One thing I do see a lot, though, is people coming refusing interventions, but they don't really understand why they're refusing them or what it even means to refuse those interventions because they have seen videos and blog posts and social media posts about their right to refuse and keeping their autonomy. And they just say, I don't want that, but they don't really have an understanding of what it means to decline certain interventions. So I think it's key that people understand what it means to decline interventions, understand what each intervention, declining each intervention means, and why we recommend it. And yes, that all goes in line with informed decision-making, which I do agree that overall, healthcare providers are not the best at, and they have to do better, especially with pregnancy and childbirth. So this whole intervention and childbirth controversy, if you will, has two parts. Number one, patients have the right to ask why and expect an answer when it comes to anything that's being done to them when they go in for labor and delivery. But number two, Obstetrical care providers have to do a better job of explaining things and not assuming the patient knows what's being done and why, and not assuming the patient automatically wants it, and especially not making them think they have to do it just because we say so. I fully acknowledge, and I have acknowledged, that the patriarchy when it comes to obstetrical care is very, very deeply rooted, and that has got to change. The reason why, and I've said this before as well, so many people are willing to listen to accounts giving bad pregnancy information and advice is because of the abuses they have experienced from obstetrical care providers in prior pregnancies or their current pregnancy. Patients absolutely have a right to know everything that's going on with their care, everything that's going on during labor and delivery, and they have the right to ask questions, and they have a right to be involved in the decision-making when it comes to their labor and delivery. We have to do a better job.